But first, let us discuss why appropriate pre-operative assessment is required. The purpose of the pre-operative assessment is to confirm the diagnosis of visually significant cataract, ensure that the cataract is the cause of the visual symptoms, determine if there is coexisting ocular pathology, ensure the patient wishes to undergo surgery and understanding of specific risks, if any. Ideally, admission is done a day prior to the surgery for one-eyed and high-risk patients. Patients on day care can come 2 hours prior to surgery provided they have completed pre-operative workup at least 1 day prior to surgery. A large number of patients who require cataract surgery have concomitant chronic medical conditions that may affect the general condition, surgery or its outcome. Hence, relevant history pertaining to the medical fitness of the patient to withstand the surgical stress, post-operative medication and general care should be recorded before surgery. Few patients may have an history of drug allergies, which must be inquired and documented before surgery.